sharing the various perspectives of different stakeholders working in the digital transformation agenda. And we're really privileged to have here with us the Minister of Health of Rwanda, Dr. Sabin, who I will start with this conversation. So as we all know, Rwanda has made tremendous progress in really implementing digital health innovations and is a pioneer, as we've been hearing over and over since we've been here and as we've been witnessing firsthand. So Minister Sabin, what are some of the key policy changes, in your opinion, that are needed to support the implementation of the new Africa CDC digital health deal?
Thank you very much. Good afternoon, everyone. Thanks so much, Dr. Jean, also for the great speech and introduction to this session, Phil, and also my fellow panelists. I think this morning has been an interesting session that we're having digital technology, but today, this afternoon, we are moving into now, narrowing it down into health. We are seeing a lot of energy in the room because this is important. Speaking about the policies that we've been working on, it is important also to notice that there are policies, the guidelines, the strategies, but when they are not implemented, they remain books and papers and files and computers. And what we've been trying to do here in Rwanda is, yes, we can spend some time developing policies and guidelines and policies, but it's more important to move those ideas quickly into implementation on the ground and try to change the lives of people. Using technology is important because we are supposed to be moving faster and achieving quicker what this technology are helping with. So it has been a journey. I'm sure colleagues who are in the room have worked on this for many years, including Philbert, who have been in these policies helping in making sure tools, the digital tools are really used to drive the change. And the other factor to understand also is what comes first. Is it the digital solutions? Is it the policies that is driven because an idea has come? Is because there's a problem that needs to be fixed or dealt with? Let's say if you look into care in the health system, some of the solutions we've been implementing here is to make sure we reach the people at hospitals or at households faster, and we detect diseases, we treat, so someone gets better. And that's where the things should start, first of all, before even the policies is developed. Where the problem is, how can we fix it, develop a policy, and quickly spend more time into implementation, not more time into drafting documents. And every time be ready to make adaptations, changes, because nothing remains static. In our lives, even people will change, our nature is changing, even the climate is changing. So that is the fact also to put in context that yes, you have a policy you implement, should be ready to make changes quickly. Because in the world of technology, every day we wake up and find things have actually changed, we have to run behind. Like what Dr. Jean was saying, our kids are actually now teaching us things that we didn't know on devices we purchase ourselves. Because they learn, they play with it, and they discover things that we need to be embracing. So maybe to completely answer the question about some of the examples and where the policies have brought us to some concrete actions and solutions. I think the most known example is the use of drones, and this has been mentioned by Dr. Jean's speech, that drones initially were known to be used in other fields that are not health. And using drones to save lives has been a key transformation that was tested here for the last 10 years almost. And now we're seeing becoming more and more a practice that if you're in a remote area, someone is about to lose his or her life, you can still send a drone with blood, with medicine, with vaccines, and save that life. That is something we've been doing here for more than a decade. And now we're seeing during COVID times even expanding in other areas using robots in hospitals, informing, communicating effectively without people not moving that time. And now we're seeing robots and again drones being used to help us thinking of eliminating some diseases like malaria. So it is taking us to another level now, thinking beyond just policies, beyond these examples. There are also these artificial intelligence that can be integrated even with algorithms and inputs of huge data, then you predict and detect diseases and treat. So it's an interesting journey, and since we're hosting this meeting here, we even invite those participants to go beyond the meeting conference rooms and see some of these examples here. We're also open to learn from colleagues who are doing interesting examples of these solutions in health. I'm sure in this room there are more examples, thousands of those that we have to learn from. So maybe I'll pause there to give others a chance to also share. Thank you.
Thank you very much, Minister Sabin, for sharing with us what an enabling environment should be in terms of the policies that need to be implemented, and especially, as you mentioned, implemented, not just thought of and written, but also sharing with us some of the examples of the work that you've done here in Rwanda. And certainly, I think many of us can learn from what is being done in Rwanda, but as well, as you just said, potentially also share the experiences of other countries. This is the beauty of this type of gathering, is that it really allows to bring together different countries and stakeholders to be able to share these learnings. I will now turn to you, Ambassador Benin. The European Union is really committed to harnessing the potential of technology in a way that really puts people at the center, and while securing the sovereignty and resilience of the institution. Can you please share with us some thoughts on how development partners can support the implementation of the new Africa CDC digital health bill?
Thank you very much, Director General CDC, Minister, and all colleagues here. It's a great honor to be here today at this Health Tech Summit, even if I have papers with me. It's the tech is at the heart of everything we're driving now, going to the future. So this is a very dear thing for the European Union, and we're in the middle of a digital transformation, and this digital tech is also linking with our global health strategy. But how can development partners support the implementation of the new Africa CDC digital health tech? Well, the answer is by aligning ourselves in a strategic manner in the Africa CDC strategy, digital transformation strategy. I think this is the drive. I mean, you are at the constant of what us partners can do. We are here to align ourselves with the work you are doing, to find synergies and in the work. I think it's about coordination. It's managing to find a coordination between the national policies, the regional policies, between the CDC, the African Union, the regional economic communities, and it's building maximal synergies in the work we're doing, and also delivering to the concrete needs and that are experienced in every country. For us, it's key to find public-private partnerships. They're somehow catalytic to foster innovation and to scale up digital health solutions. The President is mentioning is also very important. For us, this is the space that we need to find a space to build these ecosystems where public and private sector can collaborate, innovate, and implement digital solutions that they are carrying out and are sustainable too. And for us, how to do that is also through very strong collaboration to pool our experience, to optimize this learning, and to find an alignment, as I said at the beginning, of what Africa has done through this digital transformation strategy applied to health. This is at the heart of the European Global Gateway, which is aiming at digital transformation and finding and delivering for our partners also on the health area, and we're looking forward to developing further later.
Great, thank you so much for those contributions. And I would like to now turn to Dr. Sani from the African Union to really be able to share as well the perspective from the African Union with us.
Thank you so much. Thank you for the conversation. I'm representing the AUIPA, the African Bureau for Animal Resources. And when we speak about human health, we cannot ignore the animal health. We're speaking about 70% of diseases coming from animal origin. So ensuring the control and the prevention of the animal diseases is a key to ensure the human health. So in AUIPA, I think digitalization had started earlier, but in a very simple way. But now we are progressing. So I will speak about the digital platform for ARIS, which is Animal Resource Information System, that we started earlier for all the African countries. And this was a platform collecting data on animal health, on diseases, outbreaks, vaccination, and control measures. Now we are going with our policies for the animal health strategy for Africa. Now we are also proceeding into the One Health. So the One Health, when we're speaking about One Health, we're speaking about sectors collaborating together, coordinating their efforts to maximize the benefits for the communities. So with the current support from the GIZ, now we have the AU OHADA, which is the One Health Data Alliance Africa. It's a project, a new project, has been launched 2 months ago, to develop and endorse a continental One Health information policy and also One Health information architecture. So with this, we can operationalize a continental One Health digital platform where all the information can be gathered together and also to be analyzed to support decisions for early detection, for prevention and control. And this is what AUIPA is doing in terms of supporting the One Health. It's not just for zoonotic diseases, we cannot ignore also the silent pandemic, the antimicrobial resistance spread. And I think many of our brothers and sisters in the human health blaming the animal production sector for the release of many antimicrobial residues in the environment. So we need to work together and to use those digital platforms as tools to coordinate our efforts. Thank you.
Thank you very much for bringing that perspective, and certainly the One Health approach is critical, and it is good to know that we have AUIR leading us in the work that you're doing. Director General in his remarks talked about how important the role of youth was, and today we are extremely privileged to have with us a youth leader that will share with us how she perceives the role of youth in the new Africa CDC digital health deals, but also share examples of innovative digital health solutions being developed and implemented. And perhaps before I give you the floor, Lola, to congratulate you, your organization received the Young Innovators for Health Award last 2 weeks ago in Accra. So big round of applause.
Thank you very much. Thank you so much for having me here. It is an honor to be here. Of course, it is an exciting time for digital health innovation in Africa, and there's so many solutions that are, making us giddy and excited. What is amazing is with technology, it's at the forefront of everything that we do, and the youth are at the helm of it. we're basically putting in everything, food, electricity, whatever it is, and of course, health is not left behind. There's so many amazing solutions. We have mobile health apps for information. We have Hello Doctor out of South Africa, for example. We have a lot of telemedicine platforms that enable patients to consult with healthcare professionals from wherever they might be. That's like, for example, we have Baobab Circle out of Kenya. We have the electronic record systems that improve data management, data analytics to ensure that policymakers are making data-based decisions for us as a continent. There's also supply chain management to reduce stockouts, which is basically like what we are doing in Pharma to ensure that people are able to get medication anywhere at any time. There's even AI for disease diagnostics. It's truly incredible. And every time I have to collaborate with one of my colleagues, I'm truly challenged to create more value because we are doing the thing. We really are doing it. And I couldn't be more proud to be in this ecosystem as an African at this time.
Thank you very much. Since we want this session to be very dynamic, instead of going for a second round with the panel, I will propose we open it up with some partners' remarks that we have, and then open it up to the audience.